Hello, and welcome to our next session, Building Sustainable Human Capacity in Asia and Africa, highlights from the Bangalore-Boston Nutrition Collaborative. My name is Katie Appel, and I am an assistant researcher for the Feed the Future Innovation Lab for Nutrition. Today, we will hear from Dr. Rebecca Kuriyan, who is professor and head of the Division of Nutrition at St. John's Medical College and St. John's Research Institute in Bangalore. Dr. Raj is the course director for a 2-week short course in international nutrition research methods since 2010, which is part of the Bangalore-Boston Nutrition Collaborative. She has published 98 peer-reviewed papers and is the author of the book, Nutrition in Obesity and Diabetes. Her main research areas include infant, child, and adolescent health, clinical nutrition, body composition, and energy expenditure. Dr. Raj, over to you.
Thank you, Katie. Good morning to all of y'all in Boston. Good afternoon and good evening to the rest of y'all. Thank you, Dr. Webb, Shibani, and all my colleagues at the Nutrition Innovation Lab for asking me and inviting me to talk to you all about the Bangalore-Boston Nutrition Collaborative and how we managed and we helped in building sustainable human capacity in both Asia and Africa and across various parts of the globe. Next slide, please. So why did we actually think of the Bangalore-Boston Nutrition Collaborative? It was because in India, there was a need for Indian professionals with appropriate skill, knowledge, and the ability to work across various disciplines and address and plan studies which will actually affect policymaking at both global and national level. There was no course actually that was comprehensive and could cover all these areas and particularly focus on nutrition research methods. Even if there were courses, they were very expensive. Additionally, no single institute had the infrastructure, methods, and expertise for conducting human nutritional studies, which could both help in influencing public health nutrition and laboratory-based analysis. Next slide, please. So our aim included scientific collaborators from SJRI, from Harvard School of Public Health, from Tufts University. We were friends and we all joined together to conduct an interdisciplinary course, which is hands-on and which would train the students with skill and knowledge to work together, plan and conduct research, which can be used from cell to society. As I said, influencing policy making. It was an ambitious plan. Next slide, please. And our pipeline dream, next slide, please. Same slide, please. And our pipeline dream was to create a course that was intellectually excellent using the in-house facility of SGRI, complemented by the faculty of Boston, infrastructure. But we had a very ambitious plan of having a course that was free for Indian participants. We also wanted to identify promising students and faculty to go for summer internships at Boston and also to develop distance-based learning. Next slide, please. So as I mentioned, this group of our friends joined together and founded the Bangalore-Boston Nutrition Collaboration. And we put it together simply with our friendship, enthusiasm, and wholehearted drive. Next slide, please. Our achievements and our key, which I just want to highlight, is we started in 2010 with about 25 students from India. And in 2011, the NIL through the USAID supported us and funded students from Nepal and Uganda. This actually added diversity to the course and brought in different students from Nepal and Uganda. The course was unique because there was no course fees, and for Indian students, travel, accommodation, and incidental costs were covered. The main highlight of the course was that each lecture was co-taught by both faculty from SJRI and Boston, and all the training was carried out at SJRI. Over the 10 years and 11 courses, we have actually trained over 550 students across the globe. Next slide, please. And as I said, in the 11 years, not just from Asia and Africa, but from all over the globe, we have managed to train students. We used a web-based learning system, where all the learning material, assessment, feedbacks were all working through the web-based learning system. We also sent 12 students and faculty from India for short summer internships in Boston. We also had students from Boston coming over for internships here. Next slide, please. The course was planned with collaborative teaching and to promote building new networking and building new partnerships. And we trained research scholars, doctors, mid-level faculty, technical consultants from various government organizations, public health officers, and also policy advocating officers. And as you can see from these pictures, Dr. Webb did join us for a few years, and you can see him interacting with a lot of students. But this course was planned differently, that in the mornings we had substantiative lecture courses, which were, as I mentioned, co-taught by both faculty from SGRI and Boston. But in the afternoons, we had complete hands-on sessions with the facilities of the Division of Nutrition being used. And the sessions varied from global health nutrition, statistics, ethics, evidence generating, manuscript writing, and several other topics where students got an introduction to nutrition research methods. Next slide, please. This is the impact of BBNC. And as you can see, we had students from almost all parts of India, many parts of the world. And again, I would like to acknowledge that from Africa and Nepal, it was mainly through our collaboration through the NIL at Tufts. Next slide, please. The participants who came from Africa and from Nepal, they were from both governmental organizations, academic institutions, non-governmental organizations. And in the last 11 years, we have actually trained 29 students from Uganda and about 25 students from Nepal, all of whom we are in touch with and all of whom are actually transmitting and further training their people and building capacity in their institutions. Next slide, please. As you can see, is not only did we have substantiative and in the lectures and hands-on sessions in order to promote group activity and partnerships and future collaborations. On day one, we grouped the students into groups of 4 or 5, and they were made to work together in a project proposal, which they presented at the end of the 2-week course, thereby learning to work together to plan a project which they presented to the faculty on their last day. And this experience, as students, many of the students said, was intensive, but gave them the experience to work together, collaborate together, learn different cultures, and moreover, learn the basic sample size calculation, developing a budget, and also arriving at abstracts and putting up project proposals. Next slide, please. What actually made the BBNC work? It was every year we had the same first feedback, or the first strength that highlighted was that the excellent multidisciplinary team of expert faculty, as I mentioned, from both SGRI and Boston. We were lucky to have all the in-house facilities where the students could use and practice the hands-on sessions. And the students also were highly infectious, with infectious enthusiasm among them, with keen learning interests. And of course, the course was conducted every January at SGRI, beautiful weather, beautiful campus. And I think these are some of the factors that made the course work well. Next slide, please. And our ambition of having a course which was not going to be charged for any of the students was only because of our generous funding from our different funding agencies across the years. And I would like to just acknowledge all of them, because without their help and the USAID, we would not have been able to support the students and not charge a course fee. Next slide, please. We did have challenges, of course. One of the main challenges is because we had practical hands-on session, we could not take too many students and we're restricted to about 35 to a maximum of 40 students. And we could conduct it only in January, and thereby for different students, sometimes this time didn't work. Financial support every year was to have sustained financial support was a challenge, but we did manage to keep that. And until the pandemic came this year, and then this year was after a period of 11 years that we actually did not have the Bangalore-Boston Nutrition Collaboration course, short course, but we hope to restart again. Next slide, please. And I've just put up 2 testimonials from the students who came from Africa and Asia, and we conducted the survey after the BBNC, couple of years down after they had attended the BBNC. And the key points that they said that BBNC and the course they attended and the introductory lectures that they caught helped them to actually go back, write proposals, help them to plan little small studies, manuscripts, go and present it at conferences, and even take up courses further for doctorate and master courses. Next slide, please. We also did make a publication of our efforts, and it was published in the BMC Medical Education. Next slide, please. We have plans to move forward, and some of these include to create, as I mentioned, an open online course. We also want to maybe think about restructuring the course, making it more specific in specific areas of interest of the students, connect up with the BBNC students and actually see where their career has gone post BBNC, follow up on them. And, now, as I said, with the pandemic and the after effects of the pandemic, the founders of BBNC are planning to meet and actually think of moving forward for some time with the virtual BBNC. We have not yet thought about it, but that is what we are thinking of moving forward with now. Next slide, please. And I'd like to conclude by saying that BBNC is a true example of how collaboration and partnership can work well. It reflects clearly how capacity building, opportunity, and networking can be brought together and help in building capacity simply by a group of people who are friends and with the unique passion of teaching and sharing their knowledge and expertise. Every year at BBNC and after the end of BBNC, there were new friendships, partnerships that were formed, old friendships that got stronger, and the opportunities for collaborating and networking that became wider and unlimited. And I'd like to end in the words of one of our directors, Dr. Jeff Griffith, who said that BBNC is a sort of crucible where people from different backgrounds come and meet for a couple of weeks every year, contributing goodwill, good energy, and the eagerness to make the world a better place. And I heard Dr. Patrick Webb saying this morning, to make nutrition and a global environment for improving nutrition. Thank you all, and I'm happy to take any questions if you have.
Great, thank you, Dr. Raj, for your insightful presentation. The first question that we have is, what are 2 main skills that students and faculty need to have before entering the program?
Students, so some of the things that we really look back is because we want, like you said, sustained capacity building. So we encourage students who have background of nutrition, public health, who have attached to institutions and who will have the facility and the opportunity to go back and further transfer the knowledge that they learn here. Faculty is, I think, faculty interest to teach and expertise in any particular area that is an area that it is in public health nutrition, and most importantly, nutrition research methods, because the focus of our course is nutrition research methods.
Of course. Something very relevant to right now, how has your curriculum changed in training young scientists related to COVID-19?
So this actually, we have not made any change per se, because this year we did not conduct the course. And when we move towards either post-COVID towards virtual BBNC or actual BBNC, we'll have to seriously think of this point.
Mm-hmm. Absolutely. Are there any skills with that virtual training that you think you'll include or new skills to provide in the future?
Frankly, we'll have to plan this, because remember, BBNC, one of our main strength was the practical hands-on sessions. So if we are doing a virtual session, we'll have to really plan it well about which skill can be actually acquired well online.
Mm-hmm. Definitely some challenges.
Yes, that would be.
Yeah. Given your 10 years of experience, what are the biggest gaps that you've realized that need to be addressed? I guess if this could be related to COVID-19 or not, as you move forward with the BBNC program.
So I think in terms of COVID-19, I think that the main gap is how are we going to have these closed intensive sessions that we had, practical hands-on sessions. And in terms of curriculum, of course, we have to move with what is contemporary global health nutrition. That's why we will be having a brainstorming session to see if we have to change the curriculum, make it more contemporary, and what is actually important in nutrition right now.
Excellent. I think this is the final question that we have, but if you have sufficient resources for the BBNC program, could you expand the program to more countries and target more students from other low and middle income countries?
We could seriously think of that. We could, in fact, maybe plan shorter courses, but including more people and maybe expanding. But I'm sure if it's a virtual one, we could include more. But as I mentioned, we'll have to structure and plan it around so that, because the skills which have to be learned well online.
Right. Definitely. Some challenges and new opportunities.
Yes.
All right. Well, that is all we have for this session. So thank you very much to all the attendees and to Dr. Raj for her presentation. Our next session will be Generating Sustainable Human and Institutional Capacity in Uganda, starting in just a couple minutes after a brief break. Thank you all for joining us today.
Thank you.